A septoplasty is an operation to correct problems with the nasal septum, which is the piece of cartilage and bone that separates the two halves of the nose. It's a very common and safe operation. Between 20 and 30,000 are performed each year. Why would someone need a septoplasty? The most common reason is because the septum is bent, either because it's grown that way or because of an injury, and this leads to blockage of the patient's nose. The operation is designed to straighten the septum and therefore relieve the blockage.
Just lean forward, I'm just going to do it at the back. There we go, and back down.
Basically, I've broken my nose quite a few times, and where the gristle's grown back, I've actually massive problems with breathing from my nose, so hopefully this operation is going to clear my nasal passages.
So what does having a septoplasty involve? Well, first of all, it's normally done under a general anaesthetic. This means the patient is fast asleep. The anaesthetic is given by an anaesthetist who normally puts a little needle in the back of the hand and then puts a tube into the back of the throat to help the patient breathe. The next step in the operation is to make a small cut in the lining of the septum to expose the cartilage and bone underneath. Bent portions are either straightened or removed so that the septum can be put in the middle of the nose. There we go. A sliver of cartilage. There are folds of tissue inside the nose called turbinates. These can often become swollen as part of the patient's problem. A small operation using a hot needle can be done to reduce this swelling, and this is often done in conjunction with a septoplasty, which also helps to improve the patient's airway. At the end of the operation, 2 small packs are put in each side of the nose to hold everything in place. Sometimes stitches are used to help with this. Normally these are dissolving stitches and will fall out on their own. The operation normally takes about half an hour, and once it's finished, the anaesthetist will wake the patient up and they'll be taken to the recovery area where they'll be monitored and given pain control. The nasal packs which have been put in will be removed a few hours later. Soon after this, the patient will be able to go home. So what are the risks of septoplasty? Well, of course, no operation is risk-free, but septoplasty is a very safe operation. There is a small risk of bleeding. This may happen a few days after the operation and will normally settle quite quickly. So how long does it take to get over a septoplasty? Well, the main problem is the swelling caused by the surgery, which leads to a very blocked nose. This can last for 7 to 14 days. Sometimes patients will report that their front teeth feel numb or tingly, and the blockage of their nose makes their face feel uncomfortable. This will usually settle, and simple painkillers will work quite nicely for this.
Well, it's the morning after the operation, and well, fingers crossed, hopefully now I can actually, my nose is going to be working and I can actually breathe properly. So yeah, hopefully it's fingers crossed it'll be all good. Happy days.